Hi, good morning to everyone. Very grateful for this opportunity. Today, I would like to show you our study on immune phenotype in ROHHADNET patients compared to age and sex to matched patients with simple obesity. As you know, both genetic, paraneoplastic, and immune dysregulation mechanisms have been proposed as causative for determining the development of ROHHADNET syndrome, but up to now, a certain and conclusive etiology is still lacking. ROHHADNET is a complex and multidisciplinary syndrome that shares many clinical features with other well-defined syndromes. In particular, as you can see from this picture, there is a clinical overlap with autoimmune encephalitis. Both shows behavioral abnormalities, autonomic dysregulation, positive autoimmunity, the presence of similar neuropathologic findings, and oligoclonal bands. The absence of mutation of the FOX2B gene allows to distinguish this entity from congenital central hypoventilation syndrome and from late onset central hypoventilation. And similarly, methylation tests exclude Prader-Willi syndromes. The immunity paraneoplastic hypothesis arises from the association between ROHHAD clinical phenotype and the discovering of a neural crest tumor, similarly to what happens in opsoclonus myoclonus ataxia syndrome. According to literature, up to 50% of ROHHAD patients have a neural crest tumor, especially mediastinal or abdominal ganglioneuroma, ganglioneuroblastoma, and neuroblastoma, often asymptomatic and detected only through postmortem. The neuroimmunological dysfunction is a very fascinating theory. The discovery of anti-hypothalamus and anti-pituitary autoantibodies by Giacomazzi et al. And the finding of intrathecal synthesis of oligoclonal bands, generally IgG type, by Sartori et al., suggest the hyperactivation of B-differentiated cells as seen in other central nervous system immune diseases. Furthermore, the relation with autoimmune form of encephalitis was supported by neuropathology findings of specific reactive gliosis and perivascular lymphocytic infiltrate in absence of clear anatomic lesions. In particular, Gariel and colleagues reported the involvement of the hypothalamus and brainstem tegmentum with a specific pattern of inflammation consisting of both dense perivascular cuffs and patchy nodular parenchymal infiltrates. In the past, immunoglobulins and immunosuppressors as cyclophosphamide and mycophenolate have been attempted, resulting in partial and transient improvement of symptomatology. So, based on this assumption, our aim of our study is to describe the immune phenotype of peripheral blood lymphocyte subpopulation and to evaluate the cytokine and chemokine pattern in ROHHADNET patients versus control. Finally, we would like to open towards new treatment approaches. Medical history, anthropometric, hormonal, and densitometric data were collected for patients and controls. We included 14 ROHHADNET patients, of which 9 females plus 5 males. All selected patients were followed at our center, pediatric endocrine unit of Istituto Giannina Gaslini of Genova in Italy between January 2008 and December 2020. The median follow-up was 7.82 years. All patients were born at term with an adequate weight for gestational age. Median BMI at the time of blood sample was 3.8 SDS for patients. Controls were 11, 7 female plus 4 males, simple obese children matched for age and sex. Median BMI at sample day was 3.1 SDS for controls. We included patients with 3 major criteria or with 2 major plus 2 minor as shown in table. The first symptoms reported was obesity for a patient. Later, they developed the other specific symptoms like hypothalamic dysfunction, hypoventilation, endocrine disorder, and neural tumor. We excluded patients with genetic or syndromic obesity after performing genetic tests, CGH array and karyotype and Prader-Willi methylation test, and after performing brain MRI. we analyzed the Immunophenotype pro-inflammatory cytokine chemokines as HLA in peripheral blood samples, performing flow cytometric analysis. Finally, enzyme-linked immunoabsorbent assay ELISA was performed to evaluate the concentration of HLA-G or HLA-E. So, going to results, patients displayed an increase of CD4 T cells. As shown in Figure 1, phenotypical analysis of peripheral blood samples revealed that T lymphocytes are significantly increased in patients as compared to controls, with a p-value of 0.04. Such increase was related to significantly higher number of CD4 T cells in patients. In contrast, the number of B cells and NK cells was similar between the two groups analyzed. Considering a regulatory cell subset, patients displayed a significant increase of B-reg and TR1 cells. As shown in Figure 2, the number of activated CD8 T cells was significantly lower in patients with a p-value of 0.02. Instead, the expression of activation marker on TNK cells was similar between the two groups. Next, we analyzed the number of T central memory, T effector memory, T effector and T naive among CD4 and CD8 T cells in patients and controls. As shown in Figure 3, patients displayed a lower number of T effector memory than control among CD8 T cells, whereas considering CD4 T cells, patients displayed a higher number of T naive and T effectors than controls. Furthermore, we investigated whether the serum levels of pro-inflammatory cytokines and chemokines are different between patients and control. We found serum level of interleukin 8 and MCP1 higher in patients than in controls. Finally, we analyzed the concentration of the soluble isoform of immunosuppressive molecules HLA-G and He, as shown in Figure 5, as HLA-G concentration was significantly lower in patients than in controls. So, going into conclusions, our findings seem to confirm a setting of immune dysregulation in the ROHHADNET patients not observed in simple obese children without ROHHADNET syndrome. Studies on larger multicentric curves need to be performed in order to increase the strength of our finding. But if these assumptions are confirmed by other studies, new horizons for treatment will be opened. We are grateful to the Department of Neuroscience, Rehabilitation, Ophthalmology, Genetics, Maternal and Child Health, the INOGMI, University of Genova, for their support in several steps of this study,